Okay, I have 3 different quotes on communication for all of us as food for thought. The first one is, you cannot avoid communication, and you will engage in communication nearly every minute of every day of your life. I think this statement is very true. Whatever we are doing, we are communicating. When we're having the challenges, we're communicating. The next one is, to effectively communicate, we must realize that we are, no, you have, to effectively communicate, we must realize that we are all different in the way we perceive the world, and we use this understanding as a guide to our communication with others. This is by Tony Robbins. We can move on. Regardless of your interests and goals, the ability to communicate effectively will enhance and enrich your life. If you are able to communicate effectively, it gives you a different posture as far as your persona is concerned. Yeah, let's go. Okay, now we are looking at communication. Communication is basically defined as the process by which people share ideas, experiences, knowledge, feelings through the transmission of symbolic messages. However, we must know that when we talk about communication, there's always a sender, and that sender is the mastercraft of the message. And that message must pass through some medium or channel. And that channel can be either through WhatsApp, through phone call, a telephone. It can also be through Telegram. It can also be through a virtual means as we are doing right now. But the selection of the medium is very important, and the recipient. And in all this, the recipient or who is receiving this message should be able to comprehend or understand the message, so that in the end, you can receive what we call feedback. So in communicating, there must be a sender, there must be a medium through which the message will pass, then there must be a receiver. That receiver must understand the message and also give you feedback. The feedback enables the speaker or the sender to know that the message is well received and well understood. And these are the means by which we normally do this, through spoken or written words. So we can use this one. Is okay, leave this one. So let's look at the common ways of communication. The common ways of communication, we have spoken words. Just as I'm speaking, but in this case, it's becoming virtual. You cannot see me, but you can hear me. So the spoken word, you can see some through conferences, meetings, you speak, interviews, you speak, interpersonal conversation, you speak. Then written, it can be in the form of memo, reports, letters, email. All those things are written means by which we get our messages. When you talk of visual images, just like our graphs, our charts, posters, these are very strong means by which we also communicate. Because when you look at them, it gives you some meaning to whatever is on that poster. Then body language, this is the non-verbal communication. Research have shown that this constitute, you leave it, this constitute about 55% when we are communicating. Can we move on? I know the speakers can see me now. The various audience participants can see the facilitator. So can we move on? Okay, so we are looking at types and modes of communication. We've said verbal communication, conversation, interview, calls are one of them. Then we have interpersonal communication, communication with others. These are mostly informal. Then we have small group like press conferences, board meetings, team and committee meetings. I believe some of you serve on some committees at the workplace. That is a form of verbal. You talk, this one talk, and somebody is there who takes minutes about whatever goes on. Then we have public presentations, public speeches like we hear from our president on the sad news he spoke to her. That is what we call public speeches or public presentation. or you go to annual AGM conferences, people come to talk to us. Those are public presentations. Then the non-verbal have to do with the tone which we speak, our facial expressions, postures, gestures, and this non-verbal is very key in our work. Because if you're a practitioner who actually does registration in the main office, when the patient sits in front of you, you must pay particular attention, give proper eye contact. You can at times even identify that the patient is in pain. Quickly, you may arrange for a nurse to take the patient on. So please, let's watch the demeanor of our patient when they sit in front of us and we are attending to them. Then we look at written. Okay, no worry. I've spoken about it earlier on, so we can move on. We can move on. Yeah. So what are the essence of visual aids in communication? With the advent of technology, visual aids has become more prevalent and more impactful than before. Visual aids has the ability to simplify complex concepts, either through diagrams, charts, or graphs. For instance, when they say describe the function of the human heart, if you have a pictorial representation of the human heart and you are labeling it, explaining it, it makes understanding it more easier than just saying it in words. Visual representations can break down intricate ideas into simple, understandable concepts. Mostly, if you are doing your master's thesis, you hear conceptual framework. That conceptual framework explains the entire thesis you are writing and the result you are expecting. So those things, visual aids help us to interpret very complex situations. For example, a graph illustrating statistical data can provide a clear picture of trends and patterns than in a tabular form alone. Let's make progress. I think I have a table there. Yeah, we can move on. Okay. I want us to look at the purpose of communication. In general, when you ask what is the purpose of communication, you'll be told to educate, to inform, and to entertain. Today, I'm here to educate and also inform, but I'm not here to entertain you. The entertainment aspect will be the how you grasp the whole thing and give feedback. So, communication one is to inform. Communication is used to share facts, data, and knowledge. Like we are doing at this training, we will be sharing some facts and data and knowledge as well. Then expressing emotions. It allows individuals to convey their feelings, whether positive or negative. It's just like sadly, as we have lost our eight gallant Disney heroes, everybody is expressing feelings of emotion, either positive or negative. But in this case, we are commiserating with their family so that we can give them some respite and give them hope. That's what communication does. Influencing. Communication can be used to persuade, motivate, or inspire others. Then meeting social expectations. It helps individuals navigate social situations and maintain relationship by acknowledging greetings, offering thanks, or expressing condolences, as I said earlier on. Then building relationship. Communication is fundamental to forming and maintaining connections with others. And you agree with me that the person who call to check on you or send you WhatsApp message, that person have a special memory or a place in your heart. When people are talking, you can boldly say, this one person who, if he didn't hear from me 1 or 2 days, will surely give me a call or send me a message. Then coordination and collaboration. It enables groups to work together effectively by sharing information and aligning actions. Then knowledge sharing. Communication facilitates the transmission of learning and the development of understanding. These days, we are doing a lot of online learning, not necessarily be in the classroom, just like we are doing. This is a virtual platform for learning. So that's what the purpose of communication is. We can move on. This chart is a bar chart, but it also communicates to all of us. If you look at it, the blue one is saying that, and this is by Albert Herabin. He has a rule of 7%, 38%, 55%. And according to his research, 55% of our communication is through body language, which is verbal, non-verbal communication. Then 38% is by voice and tone. It's only 7% by his research constitute words. So it tells you that we must pay attention to our posture as far as non-verbal communication is concerned, because it forms a greater part of our communication in our day-to-day activities. So also our voice. Then I've listed this just to help us, because I'm not assuming all of us are at the senior level. We have biostats assistants among us, records assistants among us. We have even beginners. So some of these things, they may not straight it where it's supposed to be. So when we say non-verbal communication, your facial expression, if you are happy, we can see. If you are sad, we can see. If you are sharing tears, we can see. Then body language, including postures and gestures. When you are talking to people, please be mindful of your postures and gestures. Don't be talking to people and put your hands into your pocket. It's a disrespectful act in some cultures. So you should be mindful of it. Then eye contact is very key when you are talking to people. Then there are times you touch, but you must know who you can touch. It's not everybody that you can touch when you are speaking with the person. Then personal space is very, very key. In personal space, we have in various levels. That there are some is distance. There are some it talk about intimacy, depending on the kind of relationship and how close you can be when you are speaking with that person. Then charts, maps, and graphs, they all communicate to us. Posters that we see on the wall, they give us information. Colors that are used give us information. Silence, they say, is golden. Then dress and grooming. Please, this is also very important. We must look at the way you dress. Some of us, we wear beards that are unkept. It doesn't speak well of us. If you want to keep beard, try to trim it nicely. You should look as a gentleman. When people see you, you should be like a magnet attracting them when you are sitting down and talking to them. Then signs and symbols are all non-verbal communication. When you understand the sign, even when the person is far and he does it, you will know what the person means. This is also a non-verbal pictorial representation. But when you look at it, you see that these are clinical officers who are busy analyzing and going through the data. You can see that everybody is busy. Some are standing by desktops, some are using tablets, and you can see that everybody is analyzing something, and at the end, they'll do evaluation. And you can see they have also some charts over there. So it means that this is serious business, but it's not verbal. It communicates a message to us. We can move on. Then please, this, I think is it the last or the last but one picture I have? You see this picture, there's a story behind it. You can see that the man in the jacket, he's happy paying the worker. This worker is a teacher who teaches three subjects: mathematics, mathematics, physics, and chemistry. Apparently, the proprietor of the school, the man, every student pays 500,000 naira. But this per person, this man pays this man only 30,000 naira. How can the man be? You can see that this man, the teacher who is receiving the salary, is not happy. This is a non-verbal communication. He's telling you the man is not happy. So this man will need to be talked to, so that, and this thing, the proprietor or the headmaster or the owner of the school also needs to be talking to, because he's happy he's cheating this man. I don't know whether the pay is paying the man is happy about that. So this is just to tell you what non-verbal communication mean and the messages they communicate. I brought this image up because I know some of you are also into business, so that you don't treat the people you employ like this man is doing over here, and happy that he's paying him a meager amount. And the man is sad. You can see from the face. Let's move on. Yeah, this table also, I told you earlier on that communication have different, you have different ways of communicating. This table also communicates to us. If you look at it, it says encounter with doctors and pharmacists. So this this thing, quality assurance survey. So when you look at it, you see prompt attention on arrival, 88%. That's the positive responses. Then you have examination by doctor, a patient examination by doctor, 97%. It's just telling you the things that the patient is it benefiting or getting from the doctor. And it's a perception survey which guides us to improve on our services. So when you are presenting reports to your managers, be careful the kind of, is it graph you want to use, is it table, and how do you understand it? That's a key thing over here. So let's move on. We are all conversant with some of these things. Then I just did a pictorial representation of it. So these are bar charts. You know, bar charts have spaces in between them. If it's a histogram, they'll all be joined together. So it's on chart on encounter with doctors and pharmacists. So when you see the blue one is the positive responses. And the is it maybe you are seeing pink or orange, that is the negative responses. It's just that what is the table that has been transposed into the graphical representation. Thank you. Let's go on. So now let's look at what effective communication is. Effective communication in healthcare delivery essentially have to do with high quality, safe, and patient-centered care. It involves accurate, and timely information between healthcare professionals and patients and their other relations or family members. So what effective communication does is that it's not limited to only information to the patient care, but the relations too must as well be treated same as we are treating the patient so that compliance with treatment can be there. Fostering trust, understanding active participation in treatment decision is key in effective communication. Thank you. Effective communication in healthcare delivery is also anchored on ethical principles such as honesty, clarity, and responsibility. There's one thing we should know that once the patient is in our custody, we are responsible for whatever goes on. So we need to ensure that we deal with them honestly and we must communicate with clarity with them. Its emphasis being truthfulness, transparency, and considerate of the patient's needs and perspective. You know, the patient also have a voice. You don't behave, you know it well, when you are asking the patient question and you don't allow the patient to talk. When you do that, please, you are missing it because effective communication requires of you to listen more than to talk. Then effective communication is very crucial for building trust, fostering understanding, and maintaining positive relationship in person and in professional settings. You cannot say you communicate very well while you are at loggerheads with people in your own work setting, even in your home, in your community, please. You cannot deliver any good service to anybody anywhere if you have such mannerisms. Okay, so these are some of the building blocks. Some have talked about them, but we'll again look at them. Active listening skill is one of the key uh, ingredients of effective communication. I will explain it in the next slides. Then understanding nonverbal signs, very key. Then maintaining eye contact also is there. Then being assertive without being confrontational. You see, when we say being assertive without being confrontational, there are times some patients will come, they want to abuse you, the officers attending to them. You need to exhibit a lot of professionalism and make sure he doesn't wash your face into the gutter. But you must be careful you don't descend into the gutter with the patient. Then be mindful of people's individual space. I think I've explained space earlier on. Then using positive body language is key. You should know what to do and what not to do. There are some people, when they see people, no, they are bringing their hand forward to shake. It's not everybody that will shake. Oh. Elderly, they have to stretch their hand for you to shake. Then, to communicate effectively to you have to understand different cultures and backgrounds. You know, there are certain things that are accepted in one culture but may not be accepted in the other culture. So you must be very sensitive about people's culture and values and beliefs when you are communicating. Then now we'll now look at the ingredients. When we talk of active listening skills, what are we talking about? Is the ability to actively understand information provided by the speaker and also display interest in the issues raised or discussed. You see, when somebody is talking to you and you are not showing interest, there's no way you can comprehend what the person is saying. If you are not interested in what the person is saying, then you must find a way to draw the person's attention. Or the best thing is the speaker must find a way to engage you better. It also includes providing the speaker with feedback, such as the asking of pertinent questions, so that the speaker knows the message is being understood. Honestly, when you are talking to people and they are not asking questions, you cannot assume everything is okay or silence may concern. There are times they don't understand what you are saying, but they pretend they understand. So you must also have a way of provoking them to talk. When I say provoking them, it's not in the negative sense, but you must have a way to tickle them so that they wake up from their slumber and contribute to the subject you are discussing with them. Then in active listening skill, it's in stage, we have the comprehension stage of listening. Analysis and listen to what the speaker is saying without distraction or to active listening skills in effective communication. You need to ensure total concentration. Then this stage also calls for tolerance, with very important at this stage. There are times people are talking to you, you may take what you are saying, excuse me, this is not relevant. But if you pay attention to them, you will take something out of it. No matter how you saw what they were talking, you will take something out of it. Then it also requires patience and also no fidgeting with phone or receiving calls. How can you believe the servant can serve two masters? So please, active listening. And some of us do this when we are attending to the patients. In my facility, my unit, we have a protocol. You cannot receive call while you are attending to the patient. You can only do so when it's related to the patient you are attending to. How does it become related to the patient you are attending to? There are times you need address, and the patient say, well, I just came here not too long, so I don't have much information. In this case, the patient may call somebody who can give you more detail about the information you need, and the patient will give the phone for you to receive that call. So there is allowed. There are no subcommittee meetings. We are at meetings, others will also be having their own meeting. How would the meeting be effective? It will not be. Then there's a stage you call retaining. No, you have moved far. Retaining. You have to go back. You have to go back. No, come down again. No, no, no. You are rather moving forward. Here. We are here. So retaining requires the listener to remember what the speaker has said so that the speaker's full message can be conveyed. In retaining, you should be able to do paraphrasing, summarize, what the speaker has said. In retaining, we should be able to paraphrase and summarize what the speaker has said. For example, are you trying to say? Do you mean to say? You see, this gives the speaker the idea that you are listening to me and you understand what I'm saying, but you need clarity on some of the issues. We can move on. Then responding, then we have also the respond. We have done comprehension, retaining, then we have responding. It's the art of providing both verbal and non-verbal feedback to the speaker, which means the listener is both hearing and understanding what the speaker has said. In responding, the speaker must feel heard, and the listener can use several techniques to accomplish this end. Some of the clues may involve non-verbal, head nods, smiles, verbal, I see, tell me more. Responding is a way of testing your understanding by clarifying what the speaker has said. It enables you to have the correct facts and demonstrate your understanding. Note that eliciting facts is one of the basics of active listening. A simple way of demonstrating this component is in conversation is to rephrase or restate what has been said back to the speaker. Yeah, we are looking at key aspects of effective communication, but I can see that some of our colleagues are having challenges with their network. They keep on posting charts on the screen. So, organizer, if there's a way you can help them, try to sort them out. Yeah, active listening skills, paying close attention to what you see. So now, when we finish this, you should be able to put this thing into practice because it cuts across active listening skill. You can even Google and read more on it. Paying close attention to what.
Yeah, hello, Honorable Alamu.
Yes.
Please kindly put your video off
My
and
video.
then let's focus on yes, please. So you can use
Do I have a
this
video
mic.
on?
Yes, the video is on.
I don't know whether I have a video on.
Yeah, so just put the video on.
So but I'm not seeing a video. But I'm seeing you.
Yes, because I'm the one talking now. So
Uh-huh.
that's just a picture. So at the
Yeah, just a
bottom,
picture.
yeah. So at the
No,
bottom,
at the bottom,
when you have the share, yeah, when you have the
stop
share,
video.
yes, stop video. Yeah.
I should press on the stop video.
Right, that's it.
Okay, thank you.
Okay, yeah.
I
So
wasn't
those
seeing
of
it
us
actually as I'm
who
talking.
Yeah,
Okay,
that's
thank
fine. So
you.
those of us who are having issue with internet, kindly check your area because we are streaming
Okay,
live. When you check on YouTube, we are streaming live uninterrupted. So if you are having all channels that we are monitoring at our end here are streaming live uninterrupted. So if you are having
okay.
challenge at your end, kindly check your internet connectivity. Thank you.
Yeah, thank you very much. We must make sure you have clarity in this presentation since we are talking about communication for that matter, effective communication. So you realize that active listening skills, paying close attention to what I can't person is saying and relations are saying both verbally and non-verbally. That's why I took my time to take you through the attributes of non-verbal so that you can, if you see them, you can notice them. It's just about how focused you are and attentiveness you can determine to see that this is something that is happening to the patient. We are not nurses, but in our facility, we know how to triage. We see patient, know that this patient needs prompt attention. Quickly, you draw the nurse, OPD in charge attention, and they take care of the patient. Then verbal and non-verbal, I've spoken about this. using clear, concise language, appropriate tone, and body language that conveys empathy. Empathy is key. You know, you must put yourself in the patient's situation. When you do that, there's no way you will treat the patient anyhow. You will treat the patient with respect and also demonstrate professionalism. Clear and accurate documentation. Ensure that all information is documented thoroughly. This one, let me just take us through our own records when we are taking demographic information and biodata. You know, this time, let me say about 95% of our facilities are using LIMS. So when the patient comes and sits in front of you, there's something you must do first. Identification of the patient, and you do so by welcoming the patient and establishing rapport. Oh, sir, you are welcome. What can we do for you today? Oh, I'm not feeling too well. Oh, sir, do you have any hospital card? No. Do you have your health insurance card? Yes. You collect the health insurance card. And when you collect that health insurance card, you should identify the patient proper by asking, oh, sir, are you Raphael Kwame Alaglu? Then I say yes. Then it means that you have identified me, because there are situations whereby patient or people come with their own sons or daughters card without knowing, because we live in an environment, not all our people are well educated. So for all you know is that he has taken a card which he thinks it belongs to him. Then he brings a different card. Because we didn't do due diligence, the patient will go to a time, will even go to the consulting room and get to the pharmacy. Then they are mentioning name. He has even forgotten that he has a son called Ewena Apodo. So when they are mentioning Ewena Apodo, because it's not Ewena that he think he came to the hospital with. Finally, you have realized that I've sat at the dispensary for long. Then now it goes to us. Then they say, Then they go and say, this is the only card we have. Then so it's my son. You see, now who calls him? I will say records calls him. Because if we have done due diligence in identify the patient would have realized that he has brought the sons or the daughters card and would have corrected it. He would have gone for his own card. So please, let's work with diligence and also pay attention to detail. It's very important. Then patient education. You know, if you're a health information officer, after working for, say, 5 years onwards, you should also have learned a lot of things aside what you have been doing, because you have access to a lot of, you are the custodian. Actually, every head of department of health information, you are the custodian of all the information of the hospital, because you have access to it. Even the electronic system or folder we are using now, we still have access. You can see when the doctor has treated people, you can have access to see what were the treatment that went on, which other cadres do not have. So we are the custodians of the data. So we need to also learn other things in addition, so that we provide the patient and family with clear, understandable information about their health condition, treatment options, and management strategies. But you must always be careful that something that you don't have enough information about it, don't go and talk about it, because confidentiality is key and privacy is key over here. So when you have limited knowledge, my brother, my sister, refer the person to a senior officer who can manage the case and manage it well. Then cultural sensitivity. I spoke about, I mentioned this in effective communication, the various things that constitute it. You know, we should not take people's culture for granted. There are some people, like if you come to my area, they speak Krobo. Krobo is the local language most of them speak. If we take Krobo out, then English will come. Then Muslims too, Hausa too will come. But when our sisters that are come, they come, and you are talking to them, you know, it's insulting and irritating. The best way is, oh, Ipacho, minti krobo. Until wet me akawo, kasa we sumu. That's the way it should be. So please, if you deliberate some people's culture, language, they will deal with you ruthlessly. So in our dealing with people, when we go to barriers, I'll talk about it. I'll hold on to that. So please, we should be sensitive with culture issues. Because if you don't know how you meddle into culture issue, you can even be taken off, my brother. The kings can come after you or the commanders and they say you must be taken out of their community. In the first place, you are not one of them. But actually, these things will come through your own character and behavior. But if you handle them, me, wherever I stay, I try to learn their language because it's the only way the people will tend to love you and like you more because they identify with you. So identification in culture sensitivity is very key. Let's make progress. Then technology. You all agree with me that technology is good, but it can also frustrate you. Before we kickstart this training, for the whole day, I didn't go out. I've been indoor, making sure that I set up everything. But when it's time, it was a different thing. But thankfully, we have come out of that challenge and we are moving on. I know some brothers and sisters are facing some network challenge. We don't have a perfect situation, so let's manage it. So utilizing technology effectively to Sarah, your fast. There's something there, Sarah, because of your picture. Okay, to facilitate communication such as electronic records. This time we use electronic records. You see, those of you who have come into the system, let's say some 5 years, I mean, can say, I am koko. Those times that we started when we use folder, when you finish, somebody will come to afternoon and do filing. And there are times a patient will come. You will be looking for one folder for 2 hours and you are not getting it because it can be misfiling. These days, when they say misfiling, some of you don't understand. But those days, records was such a tedious work to do. But today, it's seamless, especially with electronic record. That is why we need to take adequate information on the patient. You see, when the patient comes, I've been to some hospital, when they get to the address place, like where I also Odumase Krobo, then they write, they don't ask you anything. Odumase Krobo, is it only Raphael Kwame Alagru who is residing there? For we at my place, we go further to ask you which part of Odumase Krobo. The person will say this thing, Kojonya. Okay, Kojonya. When we get to Kojonya, how do we get you? Oh, when you ask of Chief Bana, house, I live there. You see, you have got vivid description and address, which when you take, even when the phone numbers are not going through, you'll be able to get to the patient. Senna, my screen is awful. It's not off, but I can see Jonas.
Are we on the same page?
Yeah, no. I'm rather seeing the image of one Jonas.
Okay, give me a minute.
Okay, that's Jonas Pakis.
Yeah, that's what I'm also seeing.
Jonas, put your screen off. Put your screen off.
Yeah, the screen is on now.
Where are we? Are we here?
Yeah, we are here. We are here.
Okay.
This is where we are.
Okay.
I think with telehealth, that's telemedicine. The other time, Dr. Ajakpa spoke about this, so I will not go into that. Then feedback and evaluation. Soliciting feedback from patients and colleagues to identify areas for improvement and continuously enhance communication skills. You know, we are blessed by the work we do. We interact with patients, we talk, and it sharpens our skills. Unlike some people, it's not like that. Then collaboration and teamwork. Colleagues, if we want to give the best to the patient, we must work as a team. We cannot be in the same office and be divided on things that we do. There are some people, when they see some patients, they stereotype them and move away because they have some grudge with them in town. Please, when you come to work, whatever grudge you have with anybody in town should not affect the work. You should know that you have come to work to work. When the month ends, you will receive your remuneration. Whatever grudges you have in town should be, when you are getting to the main gate, you hang that grudges at the gate or give it to the security men or women. When you close, then you go for it. Then let's look why feedback is important in active listening. If you would have even taken this per the presentation I've made, it reflects back feelings and emotions, enables you to check whether you have the correct information or message. Feedback helps the speaker to know how the message was received and its effects. It also helps the speaker to know what you understood, how you understood his sentiment. Then it also allows you, the listener, to empathize. Very key, to empathize. You are able to put yourself into the patient's situation. You see, a patient tells you, oh, the patient is before you. Then say, oh, mommy, you look like you are not happy. You say, oh, I just lost a brother. Oh, mommy, sorry. The Lord will strengthen you. I am with you. Let's put it behind us. Death is part of us. I know how painful it is. You are putting yourself into the patient's shoe. The patient then appreciates what he's going through, and it will also help to get the right information from the patient. It helps the speaker to correct any misconception. You see, feedback will help you to correct any misconception. Maybe the way you meant it, the receiver did not get it that way, so you can quickly correct that misconception. We can go on. Then feedback, we have both positive feedback. It's always good to share, and negative feedback is a little harder one. To receive negative feedback like we received on Wednesday wasn't a good one for us. But however, we are consoled. We are consoled. Then both need to be offered if employees are expected to change behaviors. Effective feedback should be this one. In charges here, you must take it. You should know what feedback you give to your colleagues at the office. If you are in charge, I know you appraise your other colleagues every year. So please, the feedback should be fact-based and timely. You see, if I'm doing something wrong, if you don't correct me early, I would have destroyed a lot of things before you come and say it. That time, the timeliness is not there. I would have done more havoc than I shouldn't have. Then focus on specific behaviors that are clearly documented rather than vague statements about personality or attitude. You see, let your feedback be job and work related. Don't come and be talking about me and you will go crash on some things and woman in town. So you are going to use that one to penalize me at the office. That is not professional. Then the feedback should be job related and professional. Then address behaviors under the control of the person receiving the feedback. If you know what you are going to tell the person is not within the domain of the person, don't discuss it with the person. Discuss things that the person can manage and turn a new leaf and change for the better. Then let's look at, in communicating, there are barriers. We have emotional barriers. Yesterday, Reverend Joy spoke about emotional intelligence. And this can be mental and include fear. Actually, fear is a negative form. Anxiety, anger, or mistrust that affect the way people interpret and respond to messages. Then semantics, the kind of jargons we use, can affect communication. You may be using some terms that patient or the person doesn't understand. So if you know that you are not communicating, so it's a barrier. So you must look at the things that you can say that will bring meaningful understanding. Then physical barriers. Physical barrier can prevent such as distance. Noise. Noise is one barrier to communication. Then physical barriers too is when right now some people are facing internet challenge. It's a physical this thing barrier to the thing we are doing, which some of us have no control over. Then poor lighting or technological malfunction. We have that challenge even with me before we were able to switch to another device. So these things happen. But when you are not so strong, they can give you what we call cultural shock. Because you are prepared to go and deliver. Now you got there, they say light off. The screen, things are not working. You must always have a plan B behind you. Then cultural barriers. I think I've spoken about this cultural issue already. Then we have organizational barriers also, which hinders communication. When you have tall hierarchy, you have long structure. Before you can get to this one, you have to pass through this. You know, in organizations, we have the bottom-down approach to communication. The top-down, the managers, they communicate to you. You receive memo, do this. Then the down one, you send some things over there. Yours are always requests and must be sent with a lot of respect. If you do, they will shake you. Then we have the horizontal one, the lateral communication. That is between peers, heads of department of the same level. So those ones are there. So when you have tall organizational organogram, it also impedes communication. Then there is also what we call ethnocentrism. You know, when the person can, then we stereotype people. We give them tag. I get it, and we prejudice against them. All those things hinders communication. When it happens like that, you are not able to communicate well with the person. Then how do we overcome communication barriers? We need to use simple language, which are jargon-free. Then reduction and elimination of noise levels. Then we must perfect the art of active listening. Then improve on our emotional states. Then we should have simple organizational structure. Then avoid information overload. Then give good constructive feedback. Then proper media selection. You know, if you want to communicate to somebody, make sure you know the mode by which when you communicate, the person will understand what you are saying. It's also very important. Then this one is like takeaway, the 7 C's of effective communication. It's possible some people may have Googled something. When I don't touch it, they say, I didn't, he didn't know what it's about. So let me touch it briefly, even though I've talked about some of them in my presentation. Clarity is key. The message should be easily understood by the receiver using simple and direct language, no jargons. Then conciseness, it should be concise, it should be brief and straight to the point. Avoid unnecessary wording. Some of the words are repetition. You will use the same word and use that one again. No. If you want to communicate effectively, those things must be avoided. You speak to the understanding of people. Then correctness. Use specific and factual information. Avoid generalization or abstract ideas. What you are saying, it should be factual and can be verified. Then correctness. Ensure the message is accurate in terms of grammar, spelling, and facts. These days, most of us don't write letters. So we rush and short this thing. So if you want to write and construct sentences right now, then completeness. And completeness too is in our data. Correctness is in our data. So the message should include all necessary information for the receiver to understand and take appropriate action. Then consideration. Think about the receiver's perceptive, then background and knowledge level is key. When you are sending message to people, you must analyze the audience background or the patient you are speaking with. only no one call Legon. You didn't go Legon with the person. You didn't go to UPSA with Interpol with the person. So you must be considerate in what you talk about. Talk to the level of the understanding of the person you are dealing with. Then you must be courteous. Courtesy is very important. You have to be polite, respectful, friendly in your communication. You know, ideally, when a chief or queen mother, some of them you need to bow or kneel. But when they come to the hospital environment, they know that they are not in their palace. So they will not get that. But you must receive them respectfully and be very polite in dealing with them so that they know that even though I'm not in my palace, I'm accorded the needed respect as I enter that environment. So these are few benefits of effective communication in healthcare delivery. It improves patient safety and outcomes. I cited an example, but let me give you for the last time. You see that when you are able to identify the patient very well and elicit the necessary information, it will help when you get to vital signs, there are no problem. You get to the consulting room, everything moves on smoothly and patient move seamlessly and the result will be good because the patient will not be turned back. Oh, go here. You say you are 40 years, but they've written 15 years for you in the system. So due diligence, when it's done, it improves patient safety and outcome. Clear communication reduces the risk of errors and ensure that patients receive appropriate care. I think I've explained this. When we do due diligence, errors will actually be minimized. Then increase patient satisfaction and trust. You see, if you handle the patient very well, they are happy. When they are leaving, they'll tell you, God bless you. Oh, Mauna Yiro. And you never know, that one alone is more than millions of cedis. Then patients who feel heard and understood are more likely to trust their healthcare providers and adhere to treatment plans. If you realize, if you treat patients well, they become ambassadors to your facility. Because in most of our facility, we don't do adverts, but patients come. It's because of the treatment they receive. Some of them may not be receiving good treatment from us, but they don't have other alternatives. So we should take that one too. Reduced health costs. Improved communication can lead to more efficient care and fewer unnecessary tests or procedures. Because when the patient understands the procedures, he is able to communicate well with you. You will be able to get it right. And the prescribers will get it right. They may not necessarily go and be giving this thing. Some tests that may not be needed. Some at times people don't listen to the patient to finish. Then they write something for them. It has appeared at my hand the other time. When the patient was talking, the prescriber was not listening and asked the patient to go and do a particular test. When he brought the result, that prescriber was not there. So it has to go to another prescriber. When the prescriber listens to the patient complain, say, this is not what you should have done. It's this one. Now, who calls him? And the patient have to pay for that. The patient says, I won't pay because if the person have listened to me, would have avoided this. Yeah, this one, they are takeaway. Just it's part of my concluding remark. Things to make communication effective. Greet the patient when he sits before you. Establish rapport. Listen patiently. Showing empathy, very key. Avoid unnecessary medical jargon. Don't be judgmental. Clear doubts and confirming whether they have any question. Having favorable body language, the way we dress, I said it, sitting posture, eye contact, and thank the patient for coming. One thing we should know is that we are not doing any patient a favor. They rather do us a favor by coming to assess the services we are providing. So we must handle them and treat them like kings and queens, princes and princesses. So please, let's do that and we'll be good to go. These are all takeaway. So when you say, what are the things you are looking for? We are looking for clear message, correct message, complete message, timeliness of the message, meaningful message, precise message, then senders courtesy. You must thank the people always. We can go on. These are a summary to my presentation. Senor, are you there? No, I've spoken about this already. Yeah, so you must move forward. This my last slide. All those two ones I said they are conclusive. I have used this one as conclusive because it summarized everything for me. Yesterday, this question came out. They say, how do you handle a difficult patient? And I heard Reverend Joy saying, nobody is difficult. It's you who have perceived them so. But in true sense, he said there are some patients who will make things difficult for you. So how do you handle them? You have to keep your communication professional. You don't veer from things, the things you are asking and you are communicating, they are things within your realm, within your power. So you have not insulted the patient. Then you must also remain calm. The patient is aggressive, confrontational. You don't need to be also confrontational. Then your professionalism, where is it? Where is your active listening skill? Zero. Then you should speak softly. You see, patient is aggressive. You can also not be aggressive. Yours must be different. Then practice active listening. You listen to all that he or she is saying. Then give them time to talk. Do you know when you allow the patient, you go through all this that I'm saying. In the long run, the patient will tell you, now, Shamina Minkwe, won't you attend to me? Are you getting it? He will come to his senses. So you don't leave the patient. Let the patient, we call what? Let the patient ventilate. After ventilating, he or she will cool down. On this note, we'll draw the curtains on effective communication in healthcare delivery. Thank you very much for the opportunity and for the attention.
Thank you. Thank you very much, Honorable Alaglo, for this good delivery. Straightforward and to the point. Thank you so much. So
Welcome.
it is discussion time, and so we will open the floor. If you have a question or any comment you want to make, kindly put up your hand and you'll be given the opportunity to do so. Alternatively, you can post your comment or question on the chat box and the facilitator will be glad to respond to that. Thank you very much. And so the floor is open now. At this particular point, I think the admin team can post the registration link so that members can begin registration as we discuss the presentation. Thank you. So you can put up your hands. Let me go through. All right. So we have Na. Na, kindly unmute and proceed.
Okay. Thank you very much, Mr. Presentator, for your. In fact, I really enjoyed the presentation. But I have a comment to make to the professionalism. I work at a farm place HIV unit, and the way sometimes we call the HIV patient if we are trying to communicate with our staffs. Oh, the HIV case now before the relatives are there. So we should also know how to communicate professionally using our terminologies at the facilities so that other people or patients' relatives shouldn't know whatever we are mentioning. Thank you very much.
Thank you. Thank you very much for the comments. Mr. Laglu, I don't know whether you want to comment on it or we proceed.
Oh, Eric, your comment actually is on point. Some of our talking is stigmatize the patient. You know, one of the things I've noticed as far as HIV, dealing with HIV client is because they come there, they are like our family members. So familiarity brings content. That's what I've also noticed. And some of the units see those who handle them like some make this unpalatable comment. So Eric, what you are saying is very true. So I think we need to do some reorientation also for our own people at the workplace so that they know that this sickness, you can also get it. I get it. It's not somebody's deliberate this thing that they had that. So as far as professionalization is concerned, it is all part of the way we communicate. We rather tend to stigmatize them than protect their identity. Thank you very much, Eric.
Thank you. Thank you so much. Let's move to Adam. Adam Kofi, kindly unmute and proceed.
All right. Thank you very much for the opportunity, Mr. Moderator. Yeah, Mr. Raf, thank you so much for a beautiful presentation. My question is, I've come to realize that our colleagues in the clinical field, that is the nurses, the midwives, and doctors, at a point in time of their training, they were taught this sign language. You know, we are living in a society with people who have certain special abilities that we also attend to. They come to the facilities. I once encountered a patient who came and then was had a hearing impairment. It was making the sign language was very difficult. But at that moment, I had told myself that if I have any knowledge about the sign language, I would have been very happy interacting with this patient. Though I devised an alternative means by writing and then letting the patient also write back, and then everything was smooth. But I realized that if I have a knowledge about using this sign language, I don't know if our juniors or our young ones who are in school learning health information, there is a little credit hours dedicated to teach them this sign language, the basic sign language. I don't know, but I'm asking if that is not there, then I think our leaders should also look up and then take up something like this, because it is very, very important. It is very, very, and then in the presentation, I was hoping to see that, but you didn't mention that. But let's see if that is there, or if a training can also be organized for us. Just the basic ones, your name, where you come from, at least it would also help. And thank you very much again for your presentation. Thank you.
Thank you, Honorable Aglo. If you can
Adam,
touch on
thank
it.
you very much. You have made a very valid contribution, honestly. We tend to always forget these people, those who have the hearing impediment, deaf and dumb. And I agree with you. It is part of the barriers to our communication. I had it in mind, but I'm seeing the thing to be too much and I deleted it. So, Adam, is a valid point. I think what we can do is at the facility level, or we can also champion it even through GHIMA. GHIMA can have, when we go to AGM, they get one expert, take us through some 1 hour BN. We like you said, we get the simple ones. But me, I know the love one. Are you there, Adam? Yeah, thank you very much, Senna.
All right, yes. So yes, the love one is the one that is important to you. So of course, you know that one.
Pardon
Thank
me.
you so much, comrade. I said the love
Adam
one,
is there?
the one that is
Senna
the
is
most
there?
important one. The love one is the most important.
Yeah, it's the one that will help me.
Okay, thank you very much. I think we have some of us who are interpreters in sign language. I can see here indicating she's an interpreter. Okay, so yes, so we have a question in the chat box. I think we have some of us who are interpreters in sign language. I can see here indicating she's an interpreter. Mr. Senna, we are having a feedback, if you can control that. Yes, so we have
Yeah, very sorry for the feedback. So let's go to the comment section and then read those ones we have there.
Okay, all right. Thank you. So, Mr. Laglo, someone is asking, what are some of the positive ways to tackle a person to be an active listener? This is from Festus. Yes, sir. You can proceed.
Okay. From the presentation, thank you for your question. From the presentation, one of the things you do is when you are talking to the person and you realize that the person is not paying attention to you, maybe the person is fidgeting with the phone. You can tell the person that can I also have a feel of what you are looking at in your phone. You will see that the person, what you have said is not offensive. The person himself will realize actually I need to put the phone somewhere and pay attention. Then also, you must also devise a way of drawing the person's attention. There are at times the conversation becomes boring and or the speech you are delivering, so people may not pay attention to you. That is why you also need to be conversant with the body language, so that with the non-verbal communication clue, it will help you to quickly adjust what you are saying, so that you arouse the interest of the person who is you are speaking to. If not, you can't get it. But it's not something that you can just do it once and get it. It will come with experience. Are you getting it? Mhm. That's what I can add to that. Thank you.
Thank you. Thank you very much. Someone is also saying this is from Emmanuel Khalil. The presentation is top notch. God bless you. There are lots of people who really needed this training, especially the record staff. Unfortunately, they will not benefit if leadership can organize down to their level. So before Mr. Laglo will comment on this, let me just add that, yes, this training is for all health information practitioners. We did not select who participate or who doesn't participate. In fact, we planned for all the 3,000 members, and we have really invested in this particular training. And we entreated everybody to take advantage of this opportunity as members of GHIMA. And so I don't know why our record staff were left out and never joined this very important training. Maybe we'll have to work through our regional governors to identify what the challenges are, and if there is the need to do a mop-up, then we do so. Thank you very much. Mr. Laglo, you can come in now.
Oh, thank you very much. It was a good compliment for me, and I'm grateful. But like he said, everybody should have participated. So, for me, if the governors can organize a I can come and facilitate. I'm a member. Are you getting it? So that will not be a big deal for me. Actually, this presentation was meant for the AGM, but time was not there, and we have to make like we've forgotten it. But this is the right time it has surfaced again. So anytime we can revisit it. So another thing too is, if in your facility, like let's say Ho Chi Minh Hospital, they can get more than 20 people over there. That one we can do in-person training, and then add other people around the region. We can do. In-person training will even be different from this one, because I wish I'm also seeing your demeanor, but in this case, I'm not. So thank you also very much for the accolades.
Thank you. Thank you very much. The discussion time is still on. If we still have any comment or question to put forward, the opportunity is now.
Okay,
yes,
thank you
Mr.
very
Anthony,
much.
the slides will be available. The slides will be available, and so you don't need to worry about that. After the training, we'll package all the slides, and then members will have access to them. All right. Yes, so Mr. Senam.
Yeah, so thank you very much. I also want to extend acknowledgement to those of our colleagues who are joining on YouTube. Unfortunately, today there was a break in transmission on YouTube, but we got back as soon as possible. So we have some number of our colleagues who are watching live from YouTube. So far, there's no question on the YouTube channel yet, but as soon as we get some questions from the YouTube channel, Prof will be available to attend to those questions. Thank you. So doors are still open for more questions. Emmanuel Kaleo, is that the old hand or is a new one?
I think this is new. So Emmanuel, okay. Kindly unmute. Okay, I think Emmanuel's hand is down. let's go to the chat box. As from Samsung, please, why don't we decentralize the CPD before the national one? Yes, so I think it's a regional priority. It's a regional priority, and every region can organize their CPD program. If they need national support, national will come in to give them the support that is required. At the regional level, if you are able to identify a training need for your members, there is nothing wrong to organize such a training for them. Most especially, someone complaining about our record staff, who some of them are having challenges in joining the nationally organized one. We can organize in-person trainings at the regional level in our various health facilities. If any support is required by the national executives, why not? We will always be available to support such endeavors. And so it is something that is highly possible. Okay.
Thank you. And then to add to that, I also want to mention that, Kaleo, before you come in, I also want to mention that, yes, it is true. It can be done at the regional level. Just last month, with support from my regional HIO in the Volta region and the support from my regional executives, we have been able to organize a CPD training for our members in the Volta region. So it can be done at all regions. So yes, all regions can take it up. It is not something that regions cannot do. Since Volta region have been able to do it, I think other regions can also, do the same. So now we can hear from Mr. Emmanuel Kalem.
Thank you very much. Like you rightly mentioned my name. Over the past week, I've been going through those who have been able to join this training. And it's very unfortunate. I've not found anybody from my facility. Meanwhile, they are members of GHIMA. And they really need this training. Because sometimes the way they communicate to patients, if you tend to be a patient, it can be a different thing altogether. That's why I mentioned that it will be very good if this train is scaled down to their level. Because they will complain they don't have data. Some don't even have device to join and all of that. But if it is in person, I am very sure this training will impact and change the status quo. Because our names are always mentioned in wrong direction. The presentation we had, I something caught up with me that you can leave all your issues at the security man or with the security man. You enter the job, do your work, go back and pick it up. But all this information we are receiving, they have not gotten it. I can, in fact, I can tell you with facts. In my facility, I'm the only person joining. And if it is scaled down in person, it will help all of us. Thank you very much.
Thank you very much, Mr. Emmanuel Kaleo. Next on call, we have our national treasurer, Miss Eva. Your hand is up. Kindly unmute and then speak to us.
Okay, thank you. So it's good that we have organized this program. Like it has been said, it is not meant for a section of health information practitioners. It's for all of us. To me, what is the big deal about record officers? Almost everyone has a smartphone that we could join. Besides, if at your facility they are so down and they don't have enough to buy smartphone, what prevents us from projecting what we are doing, whether on your phone or a laptop, you call them around and then they learn. So I don't see why we cannot do that to help them. But it takes so much to organize such programs. And so would they be able to get money to converge at a place in a region, leave their work and go there That one, will they get money and time? But you are there with them. If you have seen their challenge and you know that they don't have smartphone, which this time even students have, whether they buy them, I mean, they are bought by parents or how they get it. But you, the senior officer, knowing that you are the one that is abreast, please help them, call them around you. You could project this on a laptop so that they could, join it and then register when the link is there. So please, when there's an issue like this, we don't wait until the last minute. Then things we could have helped, we wait to call on people from other places to help us. Thank you.
Thank you very much.
Thank you.
All right, please
Thank
continue.
you very much. Yeah. I'm just going through the chat to see whether. Okay. So someone is asking, so the region that organized CPD training for 8 members, will they still join this national one? If they can still join national, is it not a duplication? Okay. So this is from Desmond. Desmond, it might not necessarily be a duplication because the topics that are handled might not be the same. For example, Volta region, they looked at a particular set of topics, and we are also looking at different sets of topics. These are all knowledge and skills that we all need. And remember that these 5 days is not enough to give us all the skills that we require as a health information officer. And so they will only complement each other. And so that is why when regions are organizing the CPD program, they do that in connection with national, so that at the end of the day, we work together to ensure that there is no duplication of efforts. And also, when it comes to the awarding of the CPD points, sometimes the CPD points that you may get at the regional level may not be enough. And so you may need some additional CPD to complement what you have to be able to renew your PIN when the time comes. Yeah, so we try as much as possible to avoid duplication. Even if at the regional level, you are able to get all the required CPD sets to renew your PIN. Remember that we are not just there for the purposes of renewing the PINs, but we are also building our capacity and skills to be able to function as professionals. And so there is nothing wrong if you are able to get, let's say, 20 points from your region. And National has organized the CPD programs where they are discussing different topics all together, which were not discussed at your original CPD. There is nothing wrong if you join such a program because it will enhance your knowledge and your skills as well. Thank you very much. I don't know whether Honorable Senam and Honorable Alagro have something to add to this.
Thank you very
thank
much
you
for
very
your
much,
submission.
organizers. Let me say that you people have done very well. I have been able to actually join 3 of them because the time we started, I was also at NEC at Kumasi, but I try to, when I get time small, I try to listen. You have done very, very well. The coordination has been nice. It's only how we can whip the interest of our members, because this is free, so that they will join to acquire some knowledge, build their own capacity. And like Eva said, when you get the slice, you can do small in-house training at your various BMC with your colleagues. I think that one will help. And I thank all of you so much for the good accolades that I'm reading from the comment section. I'm also encouraged and motivated for your participation. God bless us all.
Yes, you deserve the accolades, Honorable. Thank you so much. So still in the chat box, okay. How will it cost for non-members who had the opportunity to participate in this training? Yes. So on the first day, we announced that for non-members, for them to get a CPD awarded is 200 Ghana cedis. That is payable to the treasurer. And the Momo number was made available. So treasurer, if you can post the Momo number again on the chat box for those who are non-members and they are participating in this program. Thank you so much. So I think time is fast. It is a bit past 4 p.m. And Honorable Senator, if you agree with me, I think we need to bring this session to a close by going through the closing ceremony, which will also take some few minutes, about 10 to 15 minutes. Honorable Senator.
Yes, thank you very much, Honorable Anas. I perfectly agree with you. So we can proceed and then wrap up with the closing procedure. But before then, I think I have a pass will on. Let me quickly allow that person to just unmute and then speak to us before we proceed. She'll be the last, he or she will be the last person to speak on the presentation before we wrap up. Kindly unmute yourself.
Okay. Thank you so much. My name is Philip Hope, and I want to find out who is a non-member. Some of us are new members. So what qualifies me to be a member or a new member? That clarity. Because for example, we just heard of we heard that this program existed. I think we engaged some of you on the page, and we are now joining. And so, am I a new member or a non-member, or what is my criterion? I didn't know. You can educate me.
Thank you. Thank you very much for your question. It will be answered. Thank you.
Okay, thank you very much. So the Momo number has been posted on the page, so kindly take note of that. And my brother, to your question, a member is someone who is being deducted. Let me just go straight to the point. We are still currently undergoing the process of membership registration. So if you would notice, the various regional governors are working together with their executives to ensure that every member of GHIMA is registered in our database. And so that process is what is going on. And so for now, we regard every active member of the association to be someone who is paying dues, who is a health information professional and is paying dues to the association. And so we regard such people as members. If you're a health information officer and you are not currently paying dues, we will not regard you as a member in good standing. You are a member by profession, but you are not a member in good standing. And so ideally, if you are participating in this CPD program, you are supposed to pay because others cannot contribute their salary for you to come and enjoy free. And so every health information officer who is not currently paying dues must endeavor to work through the regional governance to ensure that they pay their dues, because there is a lot that is in stock. And those of you who have been on our page, you have seen our strategic plan that has been developed. And in order for us to be able to implement all those plans, we need money. All right.
Okay,
so
boss.
In short, that is the definition for a member in good standing. Yes.
No, like you just joined the service and you are now you just joined the group, the service. You know.
You just joined the group.
Not like a group. You just joined the Ghana Health Service as a statistician.
So you've just been employed. You've just been
employed.
Yes.
Oh, okay. So you have just been employed. Okay, that is fine. So for now, you have not contacted your regional executives, or do you know them? Let me find out first. Do you know your GHIMA regional executives? Okay, so if I can't hear you, all the point I'm making is that you need to get your regional governor to initiate the process for you to get to be an active member. So that is all that I will see. And being an active member, once you get your regional governor, they will get you registered and all the processes will be activated to ensure that you become an active member. Thank you so much.
All right. Password, if I may ask, which region are you speaking from? Okay, all right. I mean, I think it's off.
Yeah.
Hello, Senna.
Yes.
Permit me to make a comment.
All right.
Yes, boss.
In the chat box, Isabella is asking that if somebody in a situation, difficult client, shouting on top of his voice and not wanting information which you cannot give still, do you still still be professional talking to him calmly? There's one thing we should all know. There are some of the situations which will be beyond you. That is why you have in charge and seniors. When you realize that it's becoming too much for you and it will trigger you to say things that you are not supposed, just let the person and call your bosses or direct the person to see your senior colleague so that you don't find yourself in a situation whereby people will come and rather be accusing you while you can avoid the situation. So that's what we should do. Thank you.
Thank you, Honorable. We can see a lot of comments in the chat box that have to do with members or health information officers who have PINs, but they are not yet employed. What is GHIMA doing about it? I think on the second day, this issue came up. And I did indicated that as far as we are aware, there is no any plan for this year to employ allied health professionals because we were told they were not actually captured in this year's budget. Mr. Laglu is a unionist. I don't know whether he has information about this. So if there is anything that will even be done, that will be next year, hoping that the government will get fiscal space to employ new staff into the system. Remember, GHIMA, our main priority now is to try as much as possible to implement our strategic plan. And our strategic plan currently is focusing on members. Those who are yet to be members, we have to work together with the unions. Our mother union, which is Health Service Workers Union, and maybe if our regulator may also add voice to see how we can lobby government to include them in the subsequent budgets. There is nothing much that we can just do as an association when it comes to employing our members who are at home. And so that is what I have to say to that. If they want to renew their PINs, yes, they can participate in our CPD program. There is nothing wrong with that because we know they have to also keep their PINs renewed because during employment, they are required to produce active PINs. And so, yes, I think these issues even came up. Greater Accra have started an initiative to ensure that health information officers who have PINs but are not yet employed, they are, getting CPDs through this particular training program that has been organized. Yeah, so it's something that can happen.
Okay, thank you.
Yeah.
Thank you very much.
Yes, continue.
I saw one senior colleague's hand up. Mr. Achu Ayi, please kindly unmute and then speak to us. Senior Achu, please, if you're on call, kindly unmute and speak to us. I saw your hand up.
Thank you. Good afternoon to you. Please, can you hear me?
Yes, please, we can hear you.
Okay. Concerning the dues, I want to know how much is the due.
The dues deduction, you mean?
Okay. So, as far as I am aware, it is a percentage of your salary that is being deducted. And currently, we take 1% of your salary. In our last AGM in Cape Coast, there were two proposals. Either we increase it to 1.5% or 2% based on the strategic plan that we have developed and want to implement. But unfortunately, that resolution wasn't passed. And so it's a percentage of the salary. So depending on the size of your salary, the amounts differ. This is what the information I have. If treasurer is on call or any of the other executives who have additional information and may want to add can go ahead. Thank you.
Thank you very much, OS. Let's take other people who are on call. I think the question is clear and then the answer is also clear. ADB special, if you are on call, unmute and speak to us. I'll take the last three people and then we'll go on and close the program.
Good evening, executives and colleague members. Yeah, I'm Anthony, calling from Ashanti region, Methodist Hospital and Casa Precise. Please, my question is, looking at all the grading system in the health sector, I could see that only health information grading that has a lot of names, a lot of grading system in salary structure. We have records officers, biostatistics assistant, biostatisticians, technical officers, public health information, a whole lot. And because of that, it is also affecting the salaries of some members. And we have been talking about this for so many years. So what are GHIMA executives this time around? What are we doing so that we will sweep away all those names and focus on one line? Because the nurses, they only have one line. We have staff nurse, senior staff nurse, nursing officers, senior, and so on. Then midwifery, they have one line. Public health, they have one line. Why is it that the health information alone, we have a lot of names that is disturbing our grading system? Then two, the market premium. What are we still executive doing about it? Because if we are all clinicals now, we are clinicals, we are working. We have degree, especially the degree and the certificate people. Those in the biostatistician, statistics assistant, the market premium is 15%. Those in the biostatistics officers, 30%. But those in the technical officer, the diploma, they are having higher, market premium, which is 58. And it is preventing a lot of people even using their degree to come on board. What are GHIMA executives now doing? Because we are all paying dues, while some are enjoying good market premium, and whilst others too are shivering on market premium. Thank you.
Thank you. Well spoken. So let me attempt the first one, and if President is on call, he can also come on. I think when we start getting into the realm of market premium, then we are shifting focus, because that one has to do with the trade unions, for which our mother union is the Health Service Workers Union. And I know a lot has been done and a lot is still going in that particular area. What I'll only add is that sometimes when they are doing this market or job evaluation and they bring the questionnaires for us to respond to, most of us, we don't. And a clear example is the current data that is being collected by the Allied Health Council to enable them get enough information to make decisions. We have posted this several times. Members are not responding to. And so if members did not respond to and the scanty data that they get, they analyze it and they use that to make decisions. And at the end of the day, it will come back to bite us. And so for that particular one, there are two messages that I'm passing across. Number one, that one is in the area of the trade unions, which our mother Health Service Workers Union is handling that. And the second one is a call for all members that any time that we post surveys for people to respond to questions, especially when it has to do with our profession, it's a clarion call. All of us have to do so that policymakers can always have enough data and information about us And when they are making decisions, they will be guided in that direction. And I also know the issue of the different grading system within the health information sector. Discussions have started. And I recall in our last meeting, we opened a discussion on the issue of trying to define who a health information officer is. And once we are able to get this agreement, that is what we will drum forward. And that is what will let the policymakers understand that regardless of your background, the most important thing is the job that you do. And so if we all have the same job description, why the disparity? Why the discrepancy? And so this is something that has come to our attention and discussions have opened. And as we continue, we may solicit opinions from the general membership to help us in shaping decision. The president is on call, if I can remember. If there are comments he wants to pass on this, I think the floor is open. So we can do that quickly and make it a day. If president is on call, can you hear me?
Yeah, let me unmute the president.
Okay, okay.
Yeah, His Excellency, you are open.
Yes. Hello. Can I be heard?
Yes, please.
Yes. To be specific to the most recent question, I think organizing secretary has mentioned or said a lot already. Yes, salary grading and all issues are not within the domain of the association, but we also have a responsibility to communicate our grievances, our complaints and challenges to the union. If we don't do that, the union will not know what is happening to us. And so we have been in constant touch with the union front, the general secretary, the deputy general secretary. I think that this year we have also initiated a serious talk with the ministry through the Allied Health Director at the ministry. And any moment from now, we will be having, I think, the third meeting with the minister, all on these issues that we just mentioned. The salary issues, the market premium issues, the grading and the name of our grade, multiple names for one profession. They are all matters we want to look at. Another one is the link, the challenge with the link. That one is also mentioned already. We have started booking appointments with the minister. On the first and the second meeting with the minister seems to be very, very accommodating. All he needs from us, can I be heard, please?
Yes, Mr. President, loud and clear.
Okay. All the minister needs from us is when you are coming with your complaint, come with a prescribed solution. Don't come and dump complaint and then leave. The complaint will remain there and nobody will think for you. And so we have also come back as executive of the association and the director, Allied Health Director at the ministry, and then Federation. Federation is also supporting us so much. So I want to assure us that going forward, we have a brighter future. Most of our challenges will be resolved. But one serious issue, as we speak, your president at the second meeting was asked, what is your membership strength? And the categories that you have that you want to be combined or merged or aligned to one grade. And it was a shame to me that the president of Health Information Practitioners didn't have straightforward answer. I just promised that it will come. I will do due diligence to that. So organizing secretary mentioned it, that when we create questionnaire, we create links and we post. Even this program we have organized now, how many are on call? Today we are less than 400. I think the first day we were close to 500. We have not even crossed 500. But on record, we are more than 3,000, going to 4,000. And so where are the members who will speak for us individually if we don't come out to make the point? And, you can't go to these high offices and go and be speaking verbally. If you have a report from those surveys, you just put it on the table. So I will use this opportunity to, tell those on call here, let's be a keeper of GHIMA and our brothers and our sisters. When the links are posted, please don't just reply or respond alone and leave it there. Ask your neighbor, ask your professional colleague, please, have you done this? Have you done this? Have you done this? So that we can get maximum response for presentation for our consideration. I am begging members, and I want to assure members that all executives are up and doing. I have few comments also to start, maybe when I am given the opportunity to make closing remarks. And so therefore, I will say that all concerns mentioned specifically in the last questionnaire, those issues are on document and presented to the Allied Health Director at the ministry to be presented to the minister. Not soon or very soon, a national consultative meeting will be organized where all heads of health information in the agency will be called or summoned to have discussion on health information management, all issues concerning health information management. This will involve a lot of resources, a lot of funds. But if we use our money to achieve this goal, I think, or this feat, I think it is the best for us. So, organizer, thank you for the opportunity. I will pause here, and then we'll control that we can have a close end. Thank you very much.
Okay, thank you very much, Honorable.
Why?
Yeah. So, Honorable Senam, it's 4:30.
Yes, it is 4:30.
What's up?
I don't intend to take any other person, but I want to give 30 seconds each to Alexandra and Ernest to ask their questions, and then we bring it to an end. So, Alexandra, unmute, and then you have only 30 seconds. Because we'll be having an upcoming AGM where a lot of these issues will be addressed. So this is a CPD training session. So, we do not have to go deep into some of these areas. So, Alexandra.
Yes.
Yes. Mute. Oh, sorry, kindly mute yourself.
Okay.
Yeah, so Alexandra. Speak.
Yes, hello. Hello.
Yes, we can hear you. Please proceed.
Yeah, okay. My concern is about, I'm making a follow-up on the grading system. As my brother said, my brother said earlier on. I want to suggest that these all types of names we have as health information, biostats, records officers, records managers, and all that is because there are a mix of people in the system, which I will say that the only department maybe I have observed is categories of the people that we employ are different. Either you have either you have a PIN to operate or not, they employ you to be in the system. there's no any mechanism that will strictly tell you that if you are sending someone to records office or health information office, the person must be on a PIN. On the average, if you take about 10 people in the health information department in the one hospital, you can find about 3 or 4 people who are eligible, meaning that they have PIN. Then other supportive staff are also being employed, practicing as health information officers. So if we are addressing this today, and then we'll be able to look at all these measures, and then we come by, if you don't have PIN, you wouldn't be able to, operate. Because just like my brother earlier on said, all nurses have PIN and they are operating.
Okay.
You will never see any
your point is well noted.
nurse come again.
Your point is well noted. I wouldn't want you to go
Yeah.
back to what your brother spoke about.
Okay.
On the nurses area. So it is fine.
Good.
Thank you very much.
Very
your
good.
question
Very
is well
good.
noted. Thank you.
Thanks.
Ernest. Unmute and speak to us.
Well, thank you very much. I'm Ernest, the Secretary for Northeast Region. Please, my concern has to do with the membership registration form that we earlier met and then agreed that we're going to deploy for the various regions to register our members. But up to now, I haven't heard anything again. So I want to use this opportunity to find out. Northeast region, Northeast.
Northeast region. Honorable Organizer. Well, okay, so
Hello?
there's no membership registration form currently. What members are being registered on is a GHIMA database, registration database. So if your governor have not yet communicated this to you, there's a system. There's an online platform where all GHIMA members are supposed to register. And this has been decentralized to all regions to help register all members in all regions. So if you are an executive, so I am surprised you are not aware of this development. So we would communicate to your governor, and then your governor will get through to you. There's an online database system that have been deployed by GHIMA to register all members. The organizing secretary earlier spoke about this. That the system is there. I mean, all regional governors have been taken through. All regional secretaries have also been walked through on how they can register their members. And individuals can also go onto this platform and register themselves. So if you have not received this information yet, then we'll get through to you through your governor so that you would speed up registration in your region. Thank you very much. Nashiru, kindly unmute and speak to us.
Yeah, thank you very much. Good evening to you all.
Yeah, please make it brief.
Yes, I want to ask, GHIMA Greater Accra will be organizing a face-to-face CPD, face-to-face training for our members. So I wanted to know if GHIMA National could step in for us, especially with respect to getting CPD accreditation for us with Allah Health. Thank you.
Thank you very much for your question.
Okay.
Right. So, Alexandra, is it your old hand? Can you lower the hand? And then that's all the questions for the day. Honorable OS, kindly proceed.
Yes. So, Greater Accra. So there is a procedure. So you need to request that to the national officers. You need to request that through the president. And so once you request all the other information that are required, they will follow up on that, and we'll work together with the Allied Health Council to get the CPD points awarded. And so the first thing you need to do is to request, and they will pick it up from there. Thank you very much.
OS Northeast, someone is asking about registration form. which I understand we've moved very far away from registration form, and then we are now in the digital front where they have to register online. I'm
Yes,
surprised
so
an executive member is mentioning that.
yes, sorry, I couldn't follow that question, but we even did a training, right?
Yes, we did a training for
We did a
all the
training,
16
and
regions.
people, yes, and people from Northeast region participated in that training.
Very
and so
well.
if the governor is on call, maybe if you could respond to this. Honorable Alo. Honorable Alo, are you on call? Let me see. Okay. Alo is not on call today. So I will follow up on this particular issue. I remember 3 members from 3 executives from Northeast region participated in that training. I remember vividly. And so it's something that I'll personally follow up on. Yeah, thank you.
Thank you very much. Right, so let's bring the program to an end, please. OS.
Okay, thank you very much. And
please,
thank you once
before
again
you proceed.
Yes.
Before you proceed, Honorable Jojo Brown, Dean, and then Honorable Ejiman, Ashanti Regional Governor. Please, I've mentioned your name in the chat section. There are some information from your members that needs your attention. So kindly go to the chat section and then point out those, figure out those members and respond to their concerns. Thank you very much.
Thank you. Thank you very much. All too soon. We are drawing curtains to a close on the CPD webinar series for 2025. And I want to thank our facilitator for today, Honorable Alaglu, very much for making time and even taking all the pain to go through research and to get the presentation for us. We are much grateful. On this note, I'll move straight to the President to give us his closing remarks. So, Honorable Delali Ahido, if you can hear me, kindly unmute, and then your members are waiting to hear your closing remarks. Thank you very much. Honorable Senam, can you support President to unmute?
The President, unmute and speak.
Okay.
Yes, he's unmuted. Yeah, thank you. Thank you, President.
Yes. Honorable Senam will always keep me trying before allowing me. Anyway, that's good. I like the checks. I just want to use this opportunity to appreciate all participants, the organizers, all those who contributed to the organization and the first day up to today. I want to appreciate all of you. You know, this is what kind of enlightens my spirit when we all come together to achieve a common goal. And that is the only purpose of becoming together to form an association like this, professional group like this. If not attending to the group needs, the needs of the group, not the need of the individual, not the need of the president, not the need of any governor, not the need of any particular health information officer or district or region, but our collective need. When we attend and achieve a success in this manner, it gladdens some of us, our spirit and our heart. So therefore, I appreciate everybody who contributed to the success of this CPD program. I want to put it on record that from all observations from Monday to date, I am reliably convinced that we need these trainings more than we are doing. even if it's on weekly basis or monthly basis or quarterly basis, we will appreciate it than this one-time CPD thing. I heard some say when you go to some of the facilities, members will complain, we don't have that, we don't have this, we don't have smartphone, we don't have data. Please, let us be innovative at times. I think one person can just link and all others who will not want to join just because of lack of smartphone or data can join in a group. It's better than none at all. So this is just a suggestion and appeal. Like I mentioned earlier, let's be the keeper of each other. Once we are keepers of each other, we become keepers of the association. And so I am again appealing to officers who have been appointed to offices to take charge of training and accreditation. We are charging them to do more than we have seen now. Some of them are evidence to what has happened from Monday to date. They have heard the call, they have seen messages calling for more of the training. I heard some suggestions that, oh, we can even go by facility in few numbers. I want to draw or inform this house that I know in a particular facility, some group of surgeons meet weekly. Every morning by 7:30, they have started. They do 1 hour. By 8:30 to 9, they close. Every week. Even this week, Monday, they did it. Coming week, and I witnessed this for the past 2 years, and they have been consistent. This leads to professionalism, higher skills, and so forth. Look, health information, we must know that we need more skills to catch up with current technological advancement than any other profession. Health information. I saw a lot of CPD titles, training titles, so and so in the era of AI, so and so in the era of AI. Health information. In the era of AI, we have more to learn than any other profession. And so organizers of training and accreditation, membership development committees, research committees, GHIMA have all this. GHIMA is having all these committees in place to just take us through. Let us have access, let us benefit from all these kind of source of knowledge and skills and so forth. We are begging. GHIMA members are begging. I am standing on behalf of every GHIMA member and calling on all committee chairmen who, in one way or the other, has a duty to play to make sure GHIMA members have access to all sources of knowledge and skills and information. This is what I want to put across. I also want to beg members that please, the links we have posted, they are still there. The links are still within in our domain. We are going to create another quick one, and this is on links. We want to collect feedback from GHIMA members who are handling the link package, the link software. Ministry is doing its bid in collecting feedback and using it for the facility. Members are also disagreeing that what the ministry is saying is happening at the facility is not true. GHIMA, we also need our information, evidence-based, scientific-based, to present to the minister that this is what we, the users of links, in managing health information, this is our experience. And so, please, when the link comes out. Let us do well to alert our colleagues so that we respond to the questions as quickly as possible for us to be able to do the needful when we get to the higher offices. On this note, I will want to once again thank everybody, and let us be innovative, let us be current, let us strive hard to update our knowledge and skills to become high-level skilled professionals in health information management. Thank you very much. Thank you very much. Over.
Thank you. Thank you very much, Honorable President, for the closing remarks. We are very grateful. Honorable Senator, many announcements?
No announcement. I will just take this opportunity to acknowledge those who supported the third team, yourself, Honorable Anas. Let me acknowledge Mr. Emmanuel Fumado, Central Regional Governor. Let me also acknowledge Prince of the Whole Teaching Hospital. And let me also acknowledge the General Secretary who doubles as the producer also for this CPD also. And then all standing committees that contributed to this CPD training, the publicity and the editorial committee, the education and accreditation committee, and the membership development committee. All these standing committees contributed effectively to this session of the CPD. This is the first edition, and I'm sure that there will be a second edition before the year ends. So that is all I have. I acknowledge all those who supported, and thank you so very much for supporting. Your feedback have been noted, and then the next section we promise to deliver and deliver very well. Thank you so very much for joining. Over.
Thank you. Thank you very much. And thank you everyone for joining this call. In the coming days, we'll begin the process of processing your CPD. And so all the registration that have been done will be compiled. And then if there are any need for clarifications, we'll get back to you in due course. Thank you very much. And can we get a volunteer to give us a closing prayer?
We cannot get a volunteer unless we unmute someone. So, Honorable OS, kindly close us with a Muslim prayer. Today is Friday.
Thank you. Thank you very much. And shall we be in the mood of prayer? We are very grateful to the Almighty God for yet another blessing that have been bestowed upon us. The opportunity to live, the opportunity to join this meeting. We are very grateful to the Almighty for seeing us through from Monday till today, Friday, where we concluded our CPD program. We are praying that as we are ending this CPD program, we are not leaving his midst. He will continue to protect us and our families. He will continue to give us guidance. He will continue, He will continue to show us his mercies so that at the end of the day, health information professionals will be able to implement the knowledge and the skills that we have acquired through this training. Continue to bless the leaders of GHIMA, continue to bless all the members of GHIMA, and at the end of the day, we'll continue to give you the glory and the honor. Al-Uzu billahi minash shaitanir rajim, bismillahir rahmanir rahim. Alhamdulillahi rabbil alamin, ar-Rahmanir rahim, maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in wa ihdina siratal mustaqim. Siratal ladzina an'amta alaihim ghayril maghdubi alaihim waladdallin. Amen. Have a good evening, everyone.
Thank you very much, OS. Thank you all for coming. Enjoy your weekend. Bye.
Bye. Can we close the YouTube?
Yeah, suspend the YouTube.